All right, I'd like to call the December 1st, 2022 Health Committee meeting to order. We have 5 members, 1, 2, 3, 4, 5, 5 members present, so we have a quorum. We have minutes to approve from our November 3rd regular meeting. Do I have a motion? Motion by Beer, second by Bell. Any additions or corrections? Okay, hearing none. All in favor? Aye. Any opposed? Okay. Do we have any members of the public?
We do not.
Thank you. Next up is departmental matters. First is Jessica McKnight, Health Department Administrator.
Hello. No items for action, but it's my report you have, and I'd be happy to answer any questions.
Any questions for Ms. McKnight? Thank you.
Thank you.
Next is Tim Wiley from Nursing Home Administrator. Hi, you
Hello.
have 3 items for action. The first one is 4B1A, request approval of a sales order and services agreement with AccuShield. Do I have a motion? Motion by Beer, second by Martin. Do you want to make any comments about this?
Well, just in general, this is going to help us significantly with compliance, first of all, because it will enable us to be more comprehensive in the capturing of the screening data and in the mandated reporting of that data. Secondly, it will assist us even outside of the COVID realm. We'll be able to put screening questions in there relative to any GI issues that might be going around in the area or influenza A. It will also help us from an emergency preparedness standpoint, tracking individuals who are in the building should there be a disaster. We'd be able to go and pull up reports from this. It will assist us in our payroll-based journaling, which you may already be familiar with is a initiative from CMS that can involve civil money penalties if we're not able to account for all the staffing that we're needing in order to meet the requirements. We always meet the required staffing numbers, but sometimes having the information of their presence becomes a little challenging, especially with the few agency staff that we're utilizing. It will also help our existing staff significantly because they're spending a lot of time shuffling papers and manually transcribing that data. It will not replace those staff, it will relieve them. We have actually interviewed them, let them know what it would help them with, and they welcomed it because we have individuals who are taking the sheets of paper, tabulating the data, transferring that data to a spreadsheet, reformatting that data from the spreadsheet to what the federal reporting organization needs. This will automatically generate the report for the federal reporting requirements. So it should help us. The reduction in labor cost is not the elimination of people. It is the elimination of the extra time that those people are putting in toward paper shuffling, that they could better direct their energies to things that would be more meaningful and more significant for the team and for our residents. And then the thousands of sheets of paper that we're either stuck with for a while and then get rid of or just get rid of will be eliminated. So there are a lot of pluses to it.
It sounds very good. Does anybody have any questions? Member Metzger.
One thing that it talks about here is that you are responsible for implementing any long-term data retention policies. And so to help me understand, this will be electronically managed, and what are our retention, and do we have the capacity to do that within, I'm assuming that it would use the systems that we have here through our IT department. So help me understand that piece, please.
My knowledge of it is that it would be cloud-based. So we're not taking up data storage space, and we will thankfully be eliminating banker's box storage space, which is currently the challenge.
So then you will tell them what our record retention is, and then they will take care of that.
Right.
So my only other question that you may want to investigate, and that is, how do they guarantee that they have eliminated that information, so we don't have that, and that it's safely removed, so there is not access by anyone else?
So if I understand your question, you're asking, let's say, for example, that it's a 7-year retention requirement for this data. I'm not even really sure I don't even know who in the government is looking at it, but, so if I hear you right, you're saying, let's verify that when we hit those 7-year-old marks, that they are purging the system of those records. Is that correct?
Not just they are, but how are they doing it and guaranteeing that that is gone and that no one has access?
Okay.
That would be my only question. We've got to just make sure that it's adequately, there's security around that removal of that data, so.
I appreciate that feedback.
And the only other thing, I'm assuming, again, just make sure that they have the capability of changing that record retention. If something would happen that we now have it at 7 and it's 5, or we move it to 3, whatever, that we have that ability at no extra cost.
That is covered under the subscription. So
Okay, I
any-
didn't see anything, and it's okay, we don't need the details. That was just something that came to mind. And then I know that there is a warranty on the thermometer and some other things, a 3-year warranty. What about upgrades? How responsible are we for upgrading this system as it moves
It's a
forward?
great question. That's all covered under the subscription.
Very good. Okay, thank you.
Anyone else? I have a kind of a follow-up to what Member Metzger was talking about. Because are they just, on this, it's not an EMR, but you're doing health screenings. So the data that you're collecting in this is personal health data or not?
It is
Or-
not.
And that's why I think some of that concern that she might have had was
It-
that it was personal health data.
It is not HIPAA regulated to my knowledge.
Okay,
Yes.
okay, thank you.
Great question.
Yeah, that's where I think Member Metzger was kind of concerned. It just aggregated data, basically, is what it is. It's
Correct.
just numbers.
Correct.
Okay.
That being the case, then, why do we have customer is covered entity under HIPAA as one of the sales signage?
They're a
thing?
covered entity. The nursing home is a covered entity.
I'm on page 17, and I'm okay, I'm not objecting. I think this is a fine idea. I just find it interesting that if it's not HIPAA, then why do we have to be covered under HIPAA if this is not related to HIPAA in some way? Just,
Why we are covered?
I don't know. I mean, if there's nothing HIPAA-related, then why do we have to, on page 17, under Mark X, if customer is covered entity under HIPAA and has signed the attached associate agreement? So is that something we are not signing, or are we signing that? I mean, again, I'm not objecting. It's just, I was, as Chairman Schaefer mentioned, if it's not HIPAA, then I'm kind of confused by that, so.
So the program interfaces with 2 other programs that we utilize. One is Kronos, our timekeeping, and the other is with our EHR. And the reason it interfaces with our EHR is because it will associate the visitors with a resident. So it's pulling resident names, because when the visitor checks in, they will say whom they are visiting, like they do on our log, our paper log. So my assumption at this point is because there is an interface with the EHR, it's not drawing data from the EHR, but because there is an interface, there's a need for a business associate agreement.
That makes sense. Member Bell, did you have a question?
Yes, I did. It explains it more when it talks about the initial terms of the agreement begins on the date the customer signs his initials. It's terminated. It goes into what you're just asked for. So I didn't read it neither, but it's just saying that it's not prolonged. It's just at the time that they're signing into the computer. Am I correct? This is on page 17. Initial terms of the agreement. Is this where they're talking about putting your initials down? It's just like when I sign on Netflix, is this me or is this not me or something like that?
My understanding of that paragraph is it's referring to us initialing on the agreement.
Okay.
And if it's helpful, there are, I know of at least one other reputable skilled nursing facility in central Illinois that has actually utilized this since either the end of 2020 or the first part of 2021. So there's another, like I said, really reputable facility actually in the Peoria market that is utilizing this and was a good reference for it.
Okay, any other questions? If not, all in favor?
Aye.
Any opposed? Okay, it's approved. 4B, 1B is request approval of Veterans Care Agreement with the Department of Veterans Affairs. Motion by Metzger, second by Beer. Is this a new contract or is this a renewal?
As you're well aware, we have a longstanding contract relationship with the VA. They've just changed some of their processes and had to change their contracts to reflect the changes in their processes. Plus, we had two options, and we selected one that would make our reimbursement better and more predictable.
Member Metzger.
Okay, we would select the option that makes it better and more predictable. Why would you choose not to do that? I mean, so they give you two options. What's the point of the other option?
My understanding of the two options is compare it to a mortgage that is fixed rate and variable rate. And the variable rate, in order to maximize that, would take a lot of monitoring on the part of the facility.
Oh, okay.
And the fixed rate, we're able to go online and see what the rate is and know what we're supposed to be getting.
Okay, thank you.
Okay, any other questions? Hearing none, all in favor?
Aye.
Any opposed? And that one gets approved. 4B1C is request approval of medical billing collection service agreement with LTC Consulting Service LLC. Motion by Beer, second by Bell. Would you like to talk about this?
Previously, you had approved a business associate agreement with them so that they could look at our aging and tell us what they're capable of doing, and then when they returned their report as to what their strategy would be and how they would be able to help us, we then said, yes, send us the agreement. And that's what this is. This is the follow-up to the business associate agreement that I think was from the previous month.
Questions? So this is going to help us do collections.
It will be non-private pay collections, which is the bulk of our outstanding
Right.
balances.
And then at the end, or have they determined anything that would have to be passed on to finance yet? Or would that be done at the end of this period, or,
There's no determination of that nature that I'm aware of at this point.
okay. Anybody else? Member Metzger?
I'm sorry, I just used to be in contract, do some with contracts, so I just have a couple questions, and that would just be, I'm assuming that these percentages are common across the industry, so that is correct.
That is my understanding. I
Okay.
actually, in the past, I've not used an organization like this. I've used legal, and usually the percentages are way lower than this.
Okay. So my other question would be, that percentage that we would then provide them is significantly higher for each one of the categories based on how old the balance is. What is the highest percentage, or where do most of that percentage fall? And the reason I'm asking, if it is 211 days to 365 days, if it's a year old between those periods, then we're paying 20, or they're keeping 20%. So for you to budget, you would need to know, this is outstanding, we're going to only get 20, we'll get 80% versus 100%. So how are you able to, are you able to look at this and kind of determine where we fall, and what is the percentage we would commonly see, or do you think we would see?
Those are great questions. Let me clarify my previous answer. The percentages, in my opinion, the percentages that they would get for the services are good numbers. They're lower than what I'm used to seeing. If we get 60 cents on the dollar, we would be thrilled. So when we're looking at 80 cents on the dollar, those are really strong numbers. In full transparency, part of the reason I need their help is because the current state of our aging, while I understand it, I don't have the knowledge that they do to look at it and tell you where that will be, because there's a lot of cleanup work that needs to be done. I will tell you that the aging that they will be going after, which is federal, state, insurance, VA, things of that nature, those are all time sensitive. And having their assistance with this, in my opinion, will be the difference between getting 80% and getting 0. Because to try to tackle it at a facility level without that competency that they're going to bring to the table would probably take us so long that we would end up outside the window to be able to collect anything.
Thank you. Any other questions? Okay, hearing none. All in favor? Aye. Any opposed? And that one's approved. And, excuse me, do you have your monthly report?
Well, you have the report. We're just continuing it. We saw another decrease in our agency staffing by 1%, which we will take any percent we can on a monthly basis. But I welcome any questions that you might have.
Any questions, comments, committee?
I'm assuming we probably, from what I recall in the past, do not see a lot of additional census during the holidays. So we would probably see November, December flat, most likely.
Since we're through November, I can tell you that November did level out. I'm anticipating, so as far as December goes, you'll find a reduction in elective surgeries and things of that nature for our rehab. But there can actually be an uptick in people with need for ongoing care because family members come home for Christmas and didn't realize how bad mom was. And it's not uncommon around the holidays. Black Friday a lot of times can be a busy referral day for a skilled facility. As the Christmas, New Year's, the family members realize that loved ones need additional care. So some of the ongoing care could grow. Elective surgeries can be down. However, we are getting into that time of year where we affectionately refer to it as ice and pneumonia, as slips in pneumonia season, that can contribute to an uptick in rehab numbers as well.
Not that we're
No.
not wishing
Correct.
bad situations to
Right.
occur. I just needed a little bit of insight, so thank you.
Yes.
I have a question. And I guess I'm kind of concerned, and I guess you can give me your opinion on what you think. On the staffing, when you have 13 new members and you're improving recruitment of nurses, yet we have a very high turnover for the year. Do you see that changing in the next year or so? Because, that's pretty high turnover for on an annual basis. And I don't know if all skilled facilities are having that same issue too, or with the improvement in the salary study that we did, if that would have an impact on that turnover to help that be reduced. So I'm just kind of, where are we going here?
I appreciate your observation. Just a couple things from an industry standpoint. The average nationwide for turnover in skilled nursing facilities is closer to 85 to 87%. So while our numbers are not where we like, they were where we liked them, below 50%. What we're seeing now, because I study our turnover every month when I tabulate it, is some of them are people who were PRN who've not picked up shifts. So with this hiring surge, we've also, unfortunately, we've ended up with a bit of a growth in our termination numbers because we hired some people PRN. They didn't pick up the shifts like they were supposed to, and if they don't meet those requirements, we terminate them from the system. Others, we end up with a certain percentage, and I don't have a good scientific number for you, but in this day and age, unfortunately, it's a growing percentage of people who come, and after about 2 months, they either disappear or they just don't work out. So with this hiring surge, we've kind of run into this a little bit. My commitment to that is to make sure that our onboarding program is solid, that we don't have attrition due to the fact that we're failing to provide what these new hires might need. We're still finding that the turnover rate are still, for the most part, are people within their first 3 to 5 months is where we're seeing the bulk of our turnover, which is not uncommon for the industry, but is something that I'm committed to conquering. And if we look at what we're providing from an orientation standpoint and providing resources, and we feel like we're doing what we need to do, some of it is just cultural. We're bringing people on, in some cases they may not like the expectations and they don't stick around. It's hard to say because a lot of these people disappear, and when we try to follow up with them, we can't get in contact with them again. But I appreciate you being aware of that, and we are watching that.
Thank you. Anyone else?
Yes, I've worked shift work. Now, how are the people contacted? Is it nowadays everything's done over a computer system where you say you're going to be working second shift for 4 days, and then after that it's a different shift. How are they contacted? Is it personal or is it email generated?
In our nursing department, the people who, when you're referring to shift work, I don't know if you're talking about
Yeah.
swing shifts.
No, just in general, that are they called like 5 minutes before that person is needed, or they have enough time to respond to working that evening shift because they're needed?
If there's a call-off, 9 times out of 10, it's being covered by the nurse manager on duty.
And
Is,
she calls. Sorry.
She would be covering the shift. She would
Okay.
actually be coming in. So, on occasion, we may ask who's available, but, the way you're describing it, we do not operate that way, as far as just calling people on short notice and expecting them to come in to work.
Okay.
Yeah,
I like that better.
yes,
Okay,
we do
thank you.
too.
And the other comment that I would like to make is, it seems like the hospice is doing extremely well, to the point where do we have people wanting to come in and we don't have room for them?
We're not at that point yet. We have, however, started implementing some different perspectives in bed management and how we are utilizing the Serenity Lane, the 200 hall. It's now more deliberate, so it helps ensure spaces for them. So there's a bit of a triage to it. Secondly, we're not only seeing a growth in the number of individuals who are choosing the home for their hospice care, we're seeing constant or consistent increase in hospice companies wanting to bring their clients to our home, which is a tremendous position to be in. But our practice is if someone's wanting to come to us hospice, we're going to make it happen.
Okay, thank you. Anything else?
Not that I can think of.
Okay, thank you very much.
I think I'm all out of answers.
All right. Next up is Jason Tabb, Juvenile Detention Superintendent, but we have Mike Donovan, Court Services, here for Jason tonight.
Stand somewhere or gonna be in a deer stand somewhere, I guess. So,
Yeah, we get the big boss, yeah. And you do have an item for action. 4C1 is a request approval of an agreement for counseling services with Kathy Vogel. Motion by Martin, second by Beer. Sorry.
I thought it was gonna be Bev and then Martin, but
Okay, I'm sorry.
you jumped.
He jumped. And I'm just,
It's okay, get the job done, we'll get it.
This is a renewal contract for Kathy, correct?
correct. I don't really have anything more to say about it, except it's spelled out in the memo. We did increase her hourly rate per her request. But the total dollar amount's the same. She has never gone over the dollar amount.
All right. Any questions? Hearing none. All in favor?
Aye.
Any opposed? Okay, and then we have the monthly report. You have anything to say about that, or does anybody have any questions about that?
I look at it monthly with Jason, and we didn't notice anything that jumped out at us that's out of the ordinary, but I could answer questions if you have any.
Any questions? Okay, thank you, Mike. Next up is Shannon Miller from Advanced Correctional Care, Healthcare. And the information for the report for JDC, or for jail medical was given to us. Passed it out at the beginning of the meeting. Is there anything that you'd like to say first?
No, we have no actions no items for actions, and the report's there, so if you have questions, ask.
Okay. Anybody have any questions on the report?
You will see that the 14-day assessments are almost completely to our goal. We're down to, I think, just 26 or 27 left to be caught up. We started at 249, so just a pat on our back. We're making progress.
Good.
I just have a comment. I like the detail that you provided. I think that's nice to have, having numbers, but having those comments to provide a little bit more context is nice. So thank you for that.
You're very welcome. Thank you.
Anybody else? Okay, thank you.
Thanks.
Next is County Administrator, Ms. Taylor.
Thank you, Chair Schaefer. I have no items for action or to present this evening.
Okay, other business communication. I would just like to say, since there are 3 members that will not be returning to the board, although one of them is not here, that I have really enjoyed Mr. Martin and Ms. Beer and Ms. Chung as members of this committee. And I think we've had a lot of fun, and I think we've all learned a lot and had good discussions and good conversations about making sure that we're understanding what's going on in the county, in our facilities. So I don't know if either one of you would like to say anything. Okay,
I would.
Member Bell.
I've only been here a short time, and it's been a pleasure to sit next to you. And Martin, I'm worried about you. What are your plans for the future?
None.
Okay. Any other business or communication? All right. We have bills to pay. Our fun time. And the auditor has reviewed them, and they comply with all the board-adopted ordinances, resolutions, and policies. So first up is Board of Health has a prepaid total of $361,074.85. Motion by Bell, second by Beer. We're going this way.
Okay, that's fine. Switch it up. Let's go
Nobody tells me what to do.
I wasn't aware either, so
I'm the chair. I wasn't sure what was happening.
that's okay. They're guiding.
So, all in favor?
Aye.
Any opposed? Okay, that one's approved. Next is the nursing home has a prepaid total of $634,107.70. Motion by Beer, second by Metzger. All in favor?
Aye.
Any opposed? No. Okay, that one's paid. Jail and JDC Medical have a prepaid total of $79,426.01. Motion by Metzger, second by Martin. All in favor?
Aye.
Any opposed? And that one's paid. And the Developmental Disabilities Board has a prepaid total, this is going to be between you and Beer.
Bill.
No,
Oh,
because we got to give Hannah the last,
oh, got it.
prepaid total of $110,311.88. Motion by Martin, second by Beer. All in favor?
Aye.
Any opposed? We have paid all our bills, and now we are adjourned. Thank you all.